Hi, I'm Mac. I'm 10 years old, and can you get diabetes if you eat too much sugar?
My name is Mark Garnick, and I am a physician at the Beth Israel Deaconess Medical Center and a faculty member at Harvard Medical School, both of which are located in Boston, Massachusetts. And the question is, can you get diabetes from eating too much sugar? Well, first, let's talk about what is diabetes. Diabetes is a disease of the pancreas, and the pancreas is an organ in the middle portion and back portion of the abdomen that produces a substance called insulin. And insulin is a substance that allows the body to utilize sugar or glucose. And diabetes results from a relative inadequacy or a relative deficiency of insulin relative to the body's needs. And so if there's a deficiency of insulin and the person has eaten a meal and the meal contains carbohydrates, and those carbohydrates are broken down into sugar called glucose, in normal circumstances the pancreas senses that and secretes insulin to allow that blood sugar to enter into the cells and be utilized as fuel. If there is no insulin or a relative lack of insulin, what happens is that the sugar accumulates in the bloodstream and the blood sugar level actually increases because these sugar molecules are not gaining access to the inside of the cells to be utilized as fuel. So the question is, does eating excess sugar lead to diabetes? The answer is generally no. However, if we gain weight and if a person is obese, that person is more likely to have a potential for developing diabetes because the pancreas is working overtime to keep the amount of sugar in the normal range, and the pancreas is moving, is secreting more and more insulin, and that tends to cause fatigue of those pancreatic cells that make insulin in patients that are obese. By the same token, most cases of diabetes, we don't know really exactly what causes it. There are some thoughts that it's caused by an infectious agent. There are some thoughts that it's caused by the body reacting to the pancreatic cells in an abnormal fashion, leading to abnormalities of insulin production. So diabetes and sugar are closely related, but in general, eating too much sugar generally, unless it's associated with obesity, and if there is a family history leading to diabetes, generally does not cause diabetes.